I don't hope that happens, but if that was the case, the dentist can say, Naren, would you like that to stop hurting? And what's the patient going to say? Yes, please. That's why I'm here. Absolutely. Well, let me credential myself a little bit on this. Many years ago, I was invited to co-present with Dr. Omer Reed on the subject of case presentation. And we gave, thanks to Dr. Reed, I was part of the faculty that presented that. It was a 3-day course, Naren. This goes back to the mid-1980s. It was a 3-day course. It started at 7 in the morning, finished at 7 p.m., Thursday, Friday, and Saturday in Scottsdale, Arizona. So run the math on that. That was 36 hours of coursuwork.
Right.
36 hours. And by the way, I felt like we barely nicked the surface. Of course, Dr. Reed was such just an absolute gifted authority on that topic that there was so much more to learn. But that's sort of where I really took a great interest in learning more about case acceptance. Because you can have all the knowledge in the world, but if the patient doesn't say yes, that's not going to work. And can we agree, Naren, if the tooth hurts, case presentation should be pretty easy?
Yeah.
If it hurts, Naren,
Exactly.
if you were the patient and I was the dentist, and let's say, your cheek is swollen out to here and tears are rolling down your eyes, I don't hope that happens, but if that was the case, the dentist can say, Naren, would you like that to stop hurting? And what's the patient going to say? Yes, please. That's why I'm here.
Yes.
Well, this is what we would do to take care of that. And if your case acceptance isn't 100% in that case, then you might want to think about another profession, right? But now here's the reality of it. Most dentistry, by far the majority of dentistry, is either done on asymptomatic teeth, or it's something that the patient might want but not necessarily need, right? Let's talk about the asymptomatic one. And we see this every day in dentistry. A patient has a mouthful of old amalgam fillings that are
Yes.
clearly breaking down by whatever inspection you want to use. Visual inspection, radiographic inspection, photographic inspection. Even by just looking at it, you can see the margins are breaking down and it's failing. And they've sometimes been in place many years, 20 plus years, 30 plus years sometimes. But guess what? It doesn't hurt.